Good afternoon from number 6 Common Place to another of our daily updates on COVID-19, today Tuesday the 5th of May. I'm joined this afternoon by consultant geriatrician and clinical director of elderly residential services, my friend and former colleague at GHA, Dr. Antonio Marin. I want first of all, though, to express the government's and I'm sure Gibraltar's condolences to the family of Major Frank Delipiani on his passing. The Chief Minister has already expressed our condolences through a press statement earlier today, but it is fitting that I should do this here as I address you live. Apart from his career as a businessman and in the Royal Gibraltar Regiment, Frank was a minister with successive AACR governments from 1976 to 1988, serving as Minister for Municipal Services, Minister for Education, and Minister for Housing, Labour and Social Security in successive terms. Myself, as Minister for Culture, I want to specifically recognise Frank's contribution to that particular world, especially through his love of the stage, and to pay tribute to his many accomplished performances in the world of drama. Rest in peace, Frank, as you tread the boards in a better place. It isn't easy to prepare something to say at a daily press conference when by now you've all heard so much and actually know so much about what's going on. The advantage, of course, is that there are messages that we can keep repeating because they need to be heard and heard again and not forgotten. So you will forgive me if today I repeat things that I have said before, and indeed things that many of my colleagues have said before about COVID-19 and our response to it. There are, as we know, constant developments in the research into the virus and the disease that is being undertaken around the world. I can report on some of this in the knowledge that a lot of it could change completely in days or even hours. We have to respond to the changes in evidence and in circumstances. This is a time when it's actually a good thing that politicians change their minds. In these circumstances, it would be dangerous if we did not, if we were not flexible and responsive to changing information. This is not mixed messaging, it is responsible government. It's not changing rhetoric, it's responding to science. The latest that appears to be emerging is that transmission of the virus from children to adults seems to be weak. Other research seems also to suggest that it is possible that you may not catch COVID-19 more than once, that there is some immunity, which would of course be a good thing, but, and it's a huge but, this still needs to be confirmed, and so there can be no immunity passports issued yet to those who have happily overcome the infection. The third bit of information I've caught up with recently is that confidence seems to be growing in there being a reliable test for antibodies that can detect whether or not you've had the virus. These will of course be obtained as soon as they are available. As you all know, we are now in the process of a slow unlocking. This is a dangerous place to be. I, for one, have no doubt that this cautious unlocking is justified. We've had very, very few new cases now for weeks and many recoveries. This means that we are in Gibraltar pushing the virus almost to extinction. People are recovering and so killing the virus. And by keeping to our lockdown measures, we are preventing it spreading. This is exactly the way to make a species extinct. And SARS-CoV-2, the virus that causes COVID-19, is not on the protected species list, even for me. This is one species that I would like to see extinct. So we respond by lifting some of the measures we had no choice but to introduce, measures that have impacted on our liberties and on our lives. So we welcome the gradual unlocking, but it is a dangerous time. We know the virus is still out there in Gibraltar and outside Gibraltar, and it can still come back and kill us. So we have to act now with more care than ever before and not drop our guard. We now know what we have to do. We have to stay home, still. We must only go out as specifically allowed by the law when necessary and not take these stages in lockdown as an excuse to go out and socialize. And we must not try and find new excuses either. That is what the virus is waiting for, a virus that has killed tens of thousands of our fellow human beings. Before all this started, and it's just a few months ago, we were not nearly as aware of the dangers. Now we are. Now we know we have to keep our distance, that we have to protect ourselves and others, so let's make it so. Some of what many of us saw at the weekend, especially on Saturday, was stretching it a bit. Perhaps not as bad as some put it across, and we must remember not to judge others without first looking at ourselves. But some people did ignore the advice and likely infringed the law. And you know who you are. Please do not do this. Irresponsible behavior is the biggest threat to unlocking, the biggest threat to our getting back to a more normal existence, to meeting our families, sending our children to school. It's the biggest threat to getting our economy back on track. And as we overcome the public health issues, getting our economy going is critical to our well-being as a community and to us coming back to some normality. And there is no reason why the future has to be normality minus. It could, in many respects, be normality plus. But for that, we have to first beat this bug. So you have to be even more careful during unlocking than ever before. The Chief Minister yesterday announced new measures that we had discussed in Cabinet. As Fabian said yesterday, the full document will be published soon. As you can imagine, it's a very complex one to prepare with many different aspects to be borne in mind. One important point to note, once again, is that it has to be subject to change as new results emerge from research and depending on how we behave, as reflected in whether the incidence of the virus increases significantly. If, for example, last weekend did provide the virus to the opportunity to jump from people to people, from household to household, because of people trying to kid the law, then we could have a surge next week. We'll have to wait and see. I'm, of course, particularly excited about the measures that we are planning, which will have a beneficial impact on the environment. I'm able to report once again on air quality. I am pleased to say that the latest update from the Environmental Agency, which takes us up to the 30th of April, shows improvement in air quality is sustained and has even further improved slightly. Indeed, the only aspect that had not significantly improved at the report 2 weeks ago, which was particulate emission PM10 at Roger Road, has actually improved also. We must do everything we can, no matter how difficult it may be, in order to keep these improved levels of air quality in the future, for our health and for our well-being. Within another of my areas of responsibility, in culture, we continue working on our popular online program and on setting up cultural TV. Cultural Services have launched the second short story and art competitions for school years 2 to 13. The annual Spring Visual Arts Competition will this year be in a digital format. And the closing date for entries is this coming Friday. And Friday is also the closing date for expressing interest for those who wish to take part in the planned Lego exhibition. As you know, cultural organizations and individuals continue their activity at this time with many online activities daily. Tomorrow I start a round of discussions with heads of different dance schools and academies to look at how we're going to progress to the next stages in these areas. Don't worry, you will be contacted over the next few days if we haven't been in touch with you yet, if any of the dance school heads are watching. You know we know who you are, as we'd all met together in the few months before the crisis started in Gibraltar. Details of how we're intending to unlock more and more cultural activities, so much a part of our lives in Gibraltar, will be included in the document the Chief Minister referred to yesterday. Again, subject to change as the situation develops. Among the steps we'll be taking in the process is acquiring thermal screens for cultural facilities, and we're looking at ways in which we can reopen the library, contemporary galleries and the museum soon, providing limited access with pre-booked times and ensuring social distances. We will be providing more information soon. And we've had a fabulous response to the initiative to paint frontline workers. with no less than 35 artists expressing an interest. The first artwork, I'm hoping you can see it now, submitted is entitled Lest We Forget, and has been created by Stuart Santos, encapsulating his fears over the current situation. Being the first one in, we thought we could show it. The aim is to organize an exhibition with all the artworks once this is possible. And now for today's figures. First of all, at A&E in St. Bernard's, in the 24 hours to 8:30 this morning, there were 52 attendances, of which 11 were with COVID symptoms. Of these, 7 were swabbed. There was 1 admission to the COVID CCU and 1 admission to COVID John Ward. The patient admitted to CCU had had a previous negative swab, and I've just heard before going on air that today's swab was also negative, and the patient admitted to John Ward also had a negative swab. There are at the moment a total of 383 beds in our hospitals, combining St. Bernard's with the 238 in Nightingale, plus an additional 32 beds in elderly residential services, of which 25 are isolation beds. So we're very well provided with beds available for over 1% of the population of Gibraltar. The latest test statistics are as follow. Total swabs, 3,104. That's about 9-point-something% of the population. Pending, 143. Results received, 2,961. Negative, 2,713. Confirmed cases, still at 144. Active cases at 11. Recovered, 133. So this still looks that we've got it under some control, thanks to the hard work of many and the cooperation of the vast majority of our people. But if we want to transition back to our normality or normality plus, soon we must not drop our guard. We must be more aware than ever and act accordingly. And now I hand over to our consultant geriatrician and the clinical head of elderly residential services, Antonio Medina. Antonio, over to you.
Thank you, Jan. Good afternoon, everybody. Yes, I'm happy to inform that no further positive tests for COVID-19 has been detected within our premises, and all residents remain safe. This is good news. No, there's nothing else to report on COVID-19, but I would like to give some information because it's about 2 months since we started our lockdown on the nursing home. I would like to share some information with relatives and the population of Gibraltar or what's going on the nursing homes. So in total, in these past 2 months, we have carried out about 13 symptomatic swabs, and all residents were transferred to the designated isolation areas while waiting for the result. Obviously, currently having the facility to test the swab here in Gibraltar, the system is more efficient and we get the result within 24 hours. During these 2 months of converting the ERS into medical units, hospitalization of the nursing homes, we have a total of 41 episodes of medical intervention that has been carried out within our premises. Prior to this, all these cases would have been referred to St. Bernard Hospital. These medical interventions includes 6 elective cases for treatment, which were iron infusion and venesections. 22 were medical emergency requiring IV treatment, for example, acute coronary syndrome, stroke, obstructive jaundice, arrhythmias, urosepsis, and chest infections. This episode includes also the 13 cases of isolation when COVID was suspected. The death at ERS is as follows. In March 2019, last year, we had 5 deaths recorded, and in March 2020, this year, we got a 4 deaths recorded, which means a reduction in death of 20%. In April 2019, we had 10 deaths recorded, and in April 2020, this year, we have only 6 deaths recorded, which showed a reduction of 40%. The total average of death from January to April in the year 2018 and 19 were a total of 56. compared with the death from January to April in this year, which has reduced to 34. And that showed a marked reduction of 40% death in this winter period. Our records show that out of these deaths, 4 were male with an average age of 86.7 years, and 6 were females with an average age of 90.3 years. This demonstrates a precise high life expectancy in our nursing home. The main cause of death has been due to end-stage dementia in 3 cases, a cancer case, a severe peripheral vascular disease, 1 case, stroke, another patient, a cardiac event, 1 case, and 3 due to sepsis. All these cases were tested for COVID-19 and all results were negative. Last year, in 2019, between March and April, we transferred 20 residents to hospital with a total of 130 days of bed occupancy. This year, we have had 22 emergency cases, which gave us approximately the same number of beds as last year, but in this case, they were treated within the nursing homes, freeing hospital beds. In addition, ERS isolation beds were occupied by 13 patients of our residents, and which increased the bed occupancy during this period. And we estimate a roughly of 230 beds saved in St. Bernard Hospital during these 2 months. We have noticed that even in acute cases, the incidence of delirium has significantly reduced. This is mainly due to the fact that they've been treated in their own environment, but it's also due to the increment of the nursing workforces in order to provide continuity of care and the necessary cover for those nurses and staff self-isolating while waiting for the swab results. The past 2 weeks, our workforces level remained on the code green, above safe staffing levels. The staff swabbing test within the ERS is as follows. Following the public health advice, we have carried out 90 swabs at Mount Alvernia, 75 at Hillside, 25 at John McQueen, and 10 at Bella Vista, now being also a nursing home. And so far, all are negative. We will continue with our staff screening, and any suspected case will be swabbed and advised to self-isolate while pending results. We also got the outreach services provided by the ERS and GHA, led by Sandra Olmeto, and there has been a massive support for the Bella Vista service users living with dementia in the community. This service includes medical and psychological support, direct liaison with social services in order to review any package of care required at home. In addition, there have been regular home visits for those patients require more reassessment. Prescription and blister packs has been delivered to patient or carers. And the team has also arranged Meals and Wheels with the support of GATS. The memory clinic continues, obviously with limitation. I would like to thank my colleague, Dr. Amparo Diaz, for her support on continuing with the service. The lockdown will remain within the ERS sites in order to continue protecting our elderly residents and as a continuation of our precautionary measures. This will be reviewed in due course with the Health Ministry, Public Health Director, and the Civil Contingency Ministry. Thank you very much.
Thank you. Thank you, Antonio. I think we now have press questions. We have some members of the press present. I think Priya from the Chronicle, you're first.
I have a question for Dr. Marin. So how soon will families be able to visit their relatives up at ERS? I know you said this is under review, but what measures are you looking at for reviewing the cases, and also do you see any changes to these measures anytime soon?
As Dr. Cortés said earlier, that depending how the virus behaves in Gibraltar, then we need to review the current situation. As you know, the incubation period can be between 10 to 14 days. So as things has been escalating, depending what happens in the next couple of weeks, then we will review. But at the moment, it is too early to take any decision. You know that the first lockdown was in the nursing home. We believe that the last one to come out of the lockdown should be the nursing home. But by all means, we acknowledge what the family and friends are going through. It is a difficult time, but I just try to show the figures that it's been a sacrifice, but we got a good output. So I think the sacrifice should continue for a few more weeks. I think we should play safe. Thank you.
Next question.
Yes, Kevin Ruiz, GBC. I was going to ask there, lockdown at the ERS and the elderly services will probably be the last to be unlocked. You do mention there a reduction in deaths, very important detail, an interesting one as well. I suppose we'll never know how much is due to the heightened state of care and nursing brought on by the virus. But we talk a lot about a new Gibraltar, moving forward to a new Gibraltar, and lessons being learnt. What do you think we can retain from the current state of heightened nursing? Realistically, it's impossible to keep it for a prolonged period of time, but what lessons can be learned and what can we keep?
I think the figure shows not that things can be done in a different way. We all know that hospitals are not built for frail elderly. We know that sometimes we cause more harm than benefits. And I think in the GHA and the ERS, we'll have further discussion to redesign the model for future. It's not for me to say, I can advise, but I'm sure the Ministry for Health will be interested in going into a different model in the future. I have been discussing with my colleagues in the hospital. They all feel and agree that there's been a reduced pressure in the hospital, that we have increased not just the life expectancy, but also quality of life, because there's been less incidents of falls, less incidents of delirium, and the patients are quite well controlled. And perhaps we should consider in the future to move hospital to the nursing home rather the other way around. Yeah.
Okay, Minister? Yeah, I just want to touch on a bit on what Fabian, the Chief Minister, mentioned yesterday in respect of people being turned back at the frontier for having high temperatures. Has this already occurred? And to what extent will you be implementing it in the future? I'm also interested to a certain extent about how this testing service works for those people in Spain, getting Spanish labs to test them in their homes.
Okay, I'm not aware of anybody yet being turned back. It may have happened and that hasn't filtered through to me. It's a question that can be asked and we can get the information for you. I think there is justification for it. As we all know, we've been very fortunate, lucky, blessed, depends on how you see it, in Gibraltar. And obviously, as frontier movement increases, and it has increased slightly today, then obviously the more people there are, the more possibilities there are of bringing the virus through. So the temperature scan is not a fail-safe, but it is one more in our repertoire of tools to try and restrict the re-entry of COVID into Gibraltar. But I don't have the information present. I have not been told of anybody who's been turned back. The question of testing in Spain, in the case of people who may be working in Gibraltar, is something that is being discussed at the moment. I have no more details. It hasn't yet been finalized, but obviously we're looking at how we can reach out to people that on organizations, medical organizations that we have relations with clearly through the years in Spain to see whether this can be done. But we haven't done that yet.
Thank you, Minister. I'm going to read out now a question from Your Gibraltar TV. It's been sent in for you. Is the government considering allowing private medical clinics the ability to conduct their own COVID-19 tests as long as they purchase such tests via the GHA or other approved suppliers?
Okay, the last part of the question partly covers one of the concerns, and that is being certain that the tests are reliable. Because if tests aren't reliable and you get a false positive or false negative, it's not fair on Gibraltar and on the system, and it's certainly not fair on the person who's been tested. Purchasing through the GHA, which is something that cannot happen at the moment, might partly answer that question. I think it's premature to do that. I think that it's still important that the testing for something as particular, as new as this virus is correctly done through the GHA, either in our labs or in properly accredited labs. I think there's also the question of who feeds the information back to a positive patient, what counseling they get, how that is fed into it. So I think at the moment it would not be right to allow anybody else to do it. Once and if this virus gets established as one of our usual viruses, then the whole scenario will change, and it will be another virus you test for when you go to a blood test. But I think that would be premature, and it would have to be the subject of a lot of discussions and a lot of protocols between the GHA and the private entity. Antonio is a doctor, but I think he will agree that it's not the right time.
Yeah, I think so. At the moment, it's mainly a public health issue, so that's why it should be through the GHA. Once there is a specific treatment or vaccine, it will be part of the screening. Anybody else. So, and I think also because this question may come from other countries, but Gibraltar being a city country, a small population, and we got the service set up for 30,000 people in population, you can absorb the demand. Other countries with a larger population may struggle. That's why they're also using the private medicine.
Okay, thank you both. We've got another question in, this time from the Panorama. Can the Minister say, what does protecting Gibraltar from the coronavirus have to do with closing down roads?
What has... nothing. I can leave it at that. I mean, this is not a cause and effect. This is... if the question is, how can one justify closing one road, it is not as a result of the coronavirus. It's not going to solve or cure anybody from coronavirus. But it will make, well, there is one connection actually, air quality, respiratory health. And the better you are in your respiratory health, the better it will be, the better you will be able to fight the virus. It is something that we are establishing. It's being proven now with the air quality figures that are available, and I'll be releasing more during the next few days, that our air quality is improving because of reduced traffic. Therefore, there is a logical sequence. It's not going to cure it, but it's going to be better. So, I mean, it's going to be controversial. This has been on the cards for a long time, and we need better air quality if we are going to, well, live healthily and be able to have better respiratory health.
Thank you, Minister. We move back to the floor, the Chronicle Annex.
I would like to add on what Dr. Cortés said. Basically, I mean, this weekend we decided to do a walk around the rock. I was born in Spain, in the countryside. I was with my children. I explained to them that what I used to do when I was a child, just walking without being in danger with traffic. So if anything to learn from this crisis is, first of all, the air pollution that we know is bad for the coronavirus, but secondly, is improve our quality of life, doing more exercise, enjoying Gibraltar on the weekends. So
the benefits of walking and reduced traffic are not just related to respiratory health. It's safety and all sorts of other things. But this is, I'm sure that we'll be getting plenty of opportunity to talk about that in the future.
Thank you both. Chronicle, please.
Dr. Cortés, this question's for you. What measures are in place to provide PPE equipment for essential services who are not GHA staff? This comes after a reader flagged up concerns that Borders and Coast Guard agency officers were not wearing masks as they were crossing into Gibraltar.
Okay, all right. Any agency, be it a government or a quasi-government agency or any private organization carrying out services who feel they need PPE should contact the the Civil Contingencies Office, and there will be a discussion, and we'll see how we can help. Well, obviously, private entities could be expected to try and source and purchase their own. But if that is difficult or impossible, then obviously there will be a conversation, and there is a process to deal with that. I go back to masks. Remember that masks protect the person from you, if you have the virus, giving it out. It doesn't protect the person wearing the mask. And so different circumstances, there will be different needs for different types of PPE. But if anybody has a concern, they should contact the Civil Contingencies Office, and they will give them all the advice. In fact, we had a request just a few days ago through my colleague Gilbert Likudi, the Minister for the Port, about GibDoc employees when they get back to work and their PPE. The GHA advised them, and Civil Contingencies can advise them. So there is a system to provide all the advice that is necessary.
Yes, Kevin Rees, GBC. Question for both, maybe. We're now adopting a more aggressive strategy to identify and isolate the virus. And as we do, no doubt, we're going to be carrying out more tests as well. At the minute, as we know, we've discussed, we've mentioned, there are delays in those results coming back, with a proportion going over to Spain. Perhaps maybe we can know what proportion of tests are going to Spain, but also, importantly, as we move forward and as a normal activity in Gibraltar resumes, activity grows, we go back to a semblance of a normal life, is the testing locally perhaps one area that is going to be beefed up?
You remember that a few weeks ago we couldn't test locally. Zero, nothing. We had to acquire the equipment with a lot of competition from all over the world. We had to acquire the reagents. We had to train our staff. We got people coming over from UK to train the lab staff. So, we have moved a long way. At the moment, the tests that we are using, I think from the meeting we had this morning, we can turn over about 100 a day, subject to confirmation. And obviously, what will go there are the more urgent people, perhaps with symptoms that cannot wait. Anything which is more routine might then go to Spain, where there's, I think, a 2-day delay, which isn't as bad as it was at one time. So we have a certain amount of resilience there. We are obviously working closely. The GHA is working with its lab to improve, to introduce any new tests that come on board. This antibody test that I briefly mentioned earlier, I believe they have them on order, and as soon as they are being produced, we would be able to. So the whole thing is moving. The whole thing is changing. At the moment, I think we're doing okay. We would like to do better, but there are virtually daily meetings with the lab. I'm talking to Dr. Rawal today. I know they met this morning with the Director of Public Health to try and see how we can improve. Once this becomes more normal, if such a thing happens, then obviously by then there may be better equipment, there may be, the thing is developing. At the moment we're much better, much better than we were. Obviously we're going to try and get much better still.
Sorry, if I may just quickly. You talk about a 2-day delay when they go to Spain, but yet we're receiving reports that some tests are taking up to 7 to 10 days.
Not any longer. I think that this last weekend being a long weekend, there was an extra day or so, but they're not taking that as a rule. They're not taking that long. There may be the exceptional one. It hasn't come to my knowledge. But again, we discuss this virtually on a daily basis. And at our meeting this morning, we were told there had been a slightly longer delay because of the holiday weekend.
If I may add, I think we need to differentiate the swabs for symptomatic patients. I will answer as a clinician, not as a public health, obviously. And then the random test to identify any asymptomatic carrier. So the symptomatic swabs, if people that you may suspect they got it, we get within 24 hours. And in fact, if the swab get before 8 o'clock in the morning, by 2 in the afternoon you get the result. Yeah. If it goes after 8, you receive it at 9 in the evening. And that has had a significant impact in the way we can manage the suspected cases. You remember a few weeks ago, I said the workforces on the nurses was on the yellow code. Today is the green code, basically because the absenteeism, the sickness COVID-related has reduced significantly, because you may say just isolated at home for a day, maximum 2. Before, it could be 5-6 days. When you go for the swab for asymptomatic carrier, you don't need to isolate yourself. It's because if today decide to swab you all, it's not make a difference because you're not having any symptoms. So having that test within 2 or 3 days, it doesn't really matter. What we do is during this period is if I do just random tests on the frontline staff, they're still wearing the PPE to protect passing the virus to the patient should they be a carrier. But waiting a day or 2 or 3 days, it won't make a difference. In relation to the delay of 7 days, I think what it is the patient may be told in 7 days' time, but the GHA knows much sooner in advance, but there will be a delay in informing the person. But I'm sure there is any positive, they will call automatically straight away. But the negative, it may take a time for them to call every single person, and that could explain the delay.
Because they are prioritizing calling obviously the positives.
Yeah, if you got one day 150 tests, you still calling the patient doesn't answer, you call them, and that could explain the delay. Because,
Remember that I mentioned today that we'd had a couple of admissions at A&E in the last 24 hours, and I got the results before we went on air. That's a question. That's less than 24 hours. But as Antonio says, the ones that are symptomatic, that are more of a concern, are done quickly and locally. The ones that are more routine, doesn't really matter if it takes a couple of days. Fortunately, most of our sampling has turned up negative results anyway.
Okay, John. I just want to pick up on what the Chief Minister said yesterday in respect to people who did not keep to self-isolation being imprisoned. How would such a method work? Would it be a case of people being notified at the beginning and then afterwards, if they were caught outside the house, they would be imprisoned? Or is this an automatic process based on police profiling, for example?
Once again, we were discussing this morning at one of our regular core meetings in which the Director of Public Health, the Minister for Civil Contingencies, who chairs those meetings, and the Commissioner of Police. And anything that infringes one's liberty is something that is taken very seriously. But this is very serious. If you have somebody who you know is carrying this virus, blatantly disregarding all advice and disregarding the law and going around potentially spreading it, then we have to take serious steps. And if that person refuses to follow the advice and is approached by the police and continues to even obstruct the police, then obviously there are things that can happen which could lead to imprisonment. We don't want to throw anybody in prison, absolutely not. But we have to take a very, very serious view. As the Chief Minister said yesterday, all our success could be blown by one irresponsible person deciding to go around spreading this disease. We cannot have it.
Thanks, everyone. I'm just going to read a few more questions from home now. A reader has sent the Panorama the following question. If elderly people are given strict hours for going out, why are they not allowed strict hours to go to the hairdressers?
I don't think there's any particular reason for that. I think it may be one of the things that perhaps could be considered. Clearly, I haven't been to have my hair cut yet. Others have. I can see on the front row of the press. But it's something that could be considered. Remember that this golden hour was only introduced a few days ago. I think the response has been very positive and very responsible. And if there are other suggestions, like, for example, whether it's imposed by the government or whether hairdressers decide, like some of the supermarkets have decided, to do their own thing and to have certain hours for the over 70s, that's something that's very possible.
Thanks, Minister. I've got a final question from Your Gibraltar TV. Together Gibraltar, in a recent statement, has said that current levels of preparation are inadequate in order to safely relax the lockdown. The party says that not enough tests are being carried out, that masks should be worn in public at all times, that social distancing should be more stringently enforced, and that the government has issued mixed messages. What is your response to these claims?
I think I partly answered that. I actually said we are not sending mixed messages. We're just being responsible. I think one of the things that Together Gibraltar said, that at one stage we were looking at herd immunity and then we weren't. But at the beginning, everybody thought, including medical experts, that that this disease could result in greater immunity if you got it. Things then change. So therefore, it's not mixed messages, it's not changes in rhetoric, it's keeping up to date and tracking the development in the science, which I think is paramount in this. As far as preparedness goes, cast your mind back 3 or 4 months. St. Bernard's Hospital, virtually full, no capacity, respirators only enough to keep day to day. Now we have, what did I say, 380 beds available. We have a field hospital. We have about 50 ventilators. You see, when you decide how to unlock, and I mentioned this before, the Chief Minister has mentioned this before, there are certain triggers. One is the capability of the health service, in our case the GHA, to deal with the situation. Of course, we are much, much better ready to deal with this than we were a few months ago. So in that state, in that case, rather, in that situation, preparedness, absolutely. The other thing is the number of cases that are occurring every day, the number of hospitalizations, and we are fortunately, thankfully, because we're lucky, fortunate or blessed, well below those parameters. So these are what public health advice tells us, the triggers to start unlocking. And we are unlocking in a responsible way. Masks. We've already said very clearly when masks should and should not be used. It's in order to prevent a person who may be carrying it, giving it to somebody who's close by. So all these measures and all this advice is being given out. Social distancing. Everybody knows about social distancing. There are possibilities. People have complained, as I said before, on Saturday about people going out. The police is on top of it. I think they are being very pragmatic in the approach. We take a very serious view and we meet regularly with the police to ensure that they enforce as much as is possible. But you cannot throw all the responsibility in one direction. People, and I have been appealing to people today, people have to follow this advice. And people are responsible. Look, the fact that Gibraltar has been able to keep COVID-19 at bay is not just because the government and people in the GHA and elderly residential services have been working their guts out. It's because the people of Gibraltar have been responding positively. And we have to concentrate on that and be thankful for that. I think that this is absolutely the right time to start unlocking in a careful and stepwise manner. When it comes to tests, well, about 9.something% of the population has been tested. I mean, that is an extraordinary number by any means. So I totally reject that. I think we're doing it in the right way, following the right public health and medical advice, and that certainly we could see increases in the future. I've been very clear, the government has been very clear, public health has been very clear, the GHA has been very clear. We have to respond as things happen, but I think that the steps we're taking are the correct ones, and we are ready.
Thank you, Minister. We'll take one final question from GBC who are in the room.
Yes, Minister, you mentioned the antibody test, and you said you believed these were in order?
Yes, this is the, I think it's the ELISA test, which tests antibodies, and there is growing evidence that and you get different research and different publications, and I believe, subject to confirmation, that as soon as they are available, I don't think they are available, we would need about 35,000 if we were going to do the whole population.
Of course.
And I believe that they are subject to confirmation, which I would have to do. We are certainly expecting to be able to acquire them as soon as they are available, and obviously as soon as we are convinced they are reliable.
Oh, okay. Thank you.
Thank you. No further questions today.
Well, thank you all to the media, those on the other side of the computers and mobile phones, and those of you present here. Just by way of information, tomorrow I'll have the pleasure with my colleagues in GHA and the Director of Public Health to have the next of our regular meetings online with Professor Heyman of the World Health Organization, and I look forward to obtaining inside information on the latest research and thinking, which I will of course share with you again at the next opportunity. Okay, so I've said all this before, but it's important. Let's beat the bug. Let's not forget we still have work to do. Keep to our advice. Stay home, wash hands, keep your distance. As we release the restrictions, let's be even more aware, even more wary. Let's be more conscious of distance, wash hands more. Make sure you stay at home. If you have symptoms, call 111. Make all that we have done be worth it. Remember the symptoms to look out for: fever, a new cough, sore throat, fatigue or muscle pain, being unable to complete a sentence without snatching breath, and possibly headache, loose motions, loss of taste, smell, and appetite. If you have these, call 111. For other COVID-related inquiries, call 200 41818. If you are unwell with other things, don't neglect your health. The GHA is there for you too, as it's always been. Call 2000 7910. If you need a repeat prescription, call 2000 7909. If there's an emergency, remember it's 190 or 199. Stay home, stay safe, follow our advice. Let's beat it. Have a good afternoon, because for now, you can. Thank you.